So, welcome to the second session on quantitative research. And in this session, we're going to look at the different designs which are used in quantitative research studies. So it'll be useful just to recap quickly some of the information that we covered in the original session. And in that session, we discussed how quantitative research tries to stick very closely to the scientific method. And in doing that, the majority of quantitative research looks to develop hypotheses and test hypotheses from research questions. And in the development of these hypotheses, we need to identify variables that we can manipulate or measure. We need to operationalize those variables so we can put numbers next to those variables. We need to think about our sample that we're collecting from and how that represents a greater population. And then we need to think about how we then report this research and how we analyze the data that we have so that we can produce reports to disseminate our findings. In this session, we'll look at the reasons behind the use of different approaches in quantitative research. We'll try and discuss those, and we will do that through looking at some research papers which have been published and the key aspects of those research papers. And we'll also look at the strengths and weaknesses within the different designs that can be used in quantitative research. Thinking back to the model that we used in the first talk, we've got our research problem. We've operationalized that to look at developing a study hypothesis and then a null hypothesis. We've looked at the different variables, we've looked at measurement, we've looked at our sample, and so now is the time to try and design our experiment. We need to think about the different types of research design that there are. And one of the things I'd quite like you to do before we do that is to just think back to some of the recent research you may have read, or there may be a particular study that you've read that has a big impact on your practice, and think about what design that study involved. So you might want to take some time, pause this talk, and go and have a look at some of those papers and try to make sense of the research design and what were the different component parts of that, and then see how this maybe fits within the different elements that we'll look at over the series of this talk. So there are four main types of quantitative design in healthcare research, and four types of design that you'll see in palliative care studies. Some people may argue it's three rather than four, but I'll explain. So there's descriptive research, there's correlational research, and then there's causal comparative research, which is sometimes called quasi-experimental, and then there's true experimental research. Now, sometimes people will put quasi-experimental and experimental under one umbrella as experimental research, but these are the four delineations which I'm going to use to try and look at different approaches to research within quantitative methods. So it can be really tricky when you have a research question and you're trying to think about which study design to engage. And hopefully what we'll do over this talk is try and give you a bit of insight into that. And I guess what we hope is that when you're considering research design, you consider all of them, and we're trying to think of what's the best fit to address the research question that we have. And again, there are some questions that you can ask to help you think about the research design and fit the best design for your research question. So are you looking to describe phenomena or test relationships? So are you looking to look at the patterns within a particular group, or are you looking to test two variables and see how they interrelate with one another? And that will help us decide whether we want to do some descriptive research or whether we're looking for more research which has an inferential or predictive outcome to it. Will theory or data come first? So is there enough literature there that allows you to develop some research questions, or that you identify gaps within the area that you're interested in? Or do you need to collect some preliminary data to help you think about what are the key or core research questions? Are we relying on a universal theory or local knowledge? So are we trying to design an experiment which we can generalize across a whole patient population? Or are we looking to develop an experiment which is particular to the setting that we may be working in? What's the unit of analysis? So what are the variables we need to think about within our studies? And how do we operationalize those? How can we turn those into concepts which allow us to put numbers towards them that allows us to employ the statistical tests that we need to use to make sense and address our research question? Will our study be cross-sectional or longitudinal? And by this we mean, are we looking at a snapshot of the population that we're interested in? Or do we want to have a number of assessments over a period of time to look at change over time or the effects of an intervention over a period of time? Now we're trying to verify or falsify a theory. So normally within quantitative research and experimental research, we are using null hypotheses. So we are trying to falsify our theory, and that's the process through which most quantitative research is engaged. Descriptive research is the first design that we will look at. Descriptive research tells us about the world. It provides a description on the characteristics of a group or a population that we're particularly interested in. Now, that's really helpful if there's no information about this group or there's very little information. Descriptive approaches help provide us with a grounding of the key elements and aspects of that group, and it helps us to think about future research questions and supports future research. Now, we use the data within a descriptive study to present frequencies, distributions, and trends, but there's no causality implied within a descriptive research study. It doesn't manipulate the variables, it merely records them and is generally not hypothesis driven. Now, there are different techniques that can be used to do descriptive research, or surveys, which could be questionnaires, or can be interviews which have very quantitative responses to them. Observation, and that can be through specific observation of practice, but also can be through recording of what's going on previously through looking through hospital notes or data. Case studies, where we may look at a specific subsample within a particular population because there may be particularities about that group. And cohort studies, so actually a wider focus across a larger group. And again, we'll look at that in some of the studies that we'll discuss now. So one of the papers I identified for you to have a look at is the Lancet Commission report on the value of death. Now, this isn't a traditional hypothesis-driven research study. It's describing our experience and our interaction with death and end-of-life care and the impact that has on society as a large and how that may change moving forward. So this is quite a long study, quite a long report, but it's got lots of interesting and descriptive data and the typical types of things that we might see in a descriptive study. So this is one of the tables here, which talks about different aspects, including life expectancy across different countries with high, middle, and low incomes. And you can see here there's quite a difference between high-income countries and life expectancy and low-income countries. So this is one of the things descriptive data can do. It can suggest trends or areas of interest that we may want to explore later in more detailed experiment. Again, here's another graph from that study, which is looking at hospital activity in the last year of life, outpatient visits, costs, and again, useful and generating questions that we may want to examine with further experimental research. And the last table here is just about different aspects in terms of our engagement with death. So interesting here in the middle of this table, if you can see, it's about how people, where they died, and it talks about the majority of people maybe dying at home before the 1950s, and after that's increasing, and they're now to where we're in the current situation where majority of people are dying in managed care settings. So this is a really interesting study in terms of providing us with a baseline effectively and a grounding of what the situation is, and may prompt further research studies to examine some of those aspects and some of the variables that they identify there. This is an interesting descriptive study from a Dutch team looking at palliative care consultations in the hospital, and what they wanted to look at was when and why palliative care teams are consulted. They used a cohort study designed to look at a particular group of patients, and this was adult cancer patients. And the measures that they used were questionnaires which were completed by clinicians and palliative care teams, and also review of patient records to identify dates of death. Now, they used regression analysis on the data to help understand the data. And what they found when they did this was that the consultations they had were primarily with patients who had a life expectancy of 3 months or less, patients who'd had an unplanned admission to the hospital, and patients who weren't undergoing any active cancer treatment. Now, in this study, if you have a look at it, you'll find some really helpful and interesting descriptive tables. So here is one of the tables which looks at the different symptoms that patients have. And again, here's another table looking at the involvement of different members in the team in those consultations. So this is a really useful study in looking at the types of consultations the team are having, and is helpful in thinking about future planning, but also helpful in thinking about how the palliative care team may want to integrate earlier with the oncologist to try and bring palliative care upstream. The last study we'll look at is quite a famous study by David Clark and colleagues, which is also published in Palliative Medicine, and looks at the likelihood of death for patients within a 12-month period who are within the hospital setting. Now, it uses a cohort study design and records data from over 10,000 patients across 25 different hospitals in Scotland. It also looks at census data as well. Now, what they found within this study that at any one time, a third of the patients in the hospital setting were in their last year of life. The study also used regression analysis to identify that for those over the age of 85 years, 45% of those people were also in the last year of life. So again, we can tell a lot from descriptive studies and looking at descriptive data, and this can really help us think about future studies and different types of studies to test out why this pattern may exist or how we might do things to address these issues. Let's look at correlational research. So correlational research seeks to look at the relationship between two or sometimes more than two variables. And one of the things that correlational research can do is look at the strength of relationship between two variables or two concepts. So as you can see on the image here, we've got a scatter plot, and on the y-axis we have weight, and on the x-axis we have height. And from the scatter plot, we can think that actually it looks like there's a trend that as weight increases, height increases, as height increases, weight increases. So we can say there's a positive relationship between the two variables that we're examining here. But it doesn't tell us anything of the causality. Height doesn't cause weight, weight doesn't cause height. We can also determine the type of relationship. So in this graph here, on the y-axis we might have anxiety, and on the x-axis we might have days since consultation. So here we can see that very shortly after a patient consultation, there's high anxiety, but as those days increase, that anxiety may subside. So again, we'd say this is a negative correlation, whereas one value increases, the other decreases. So that's the type of relationship. So within correlational research, variables are just measured and observed. We don't do anything to those variables, we don't manipulate them or restrict them in any way. What the analysis does is it illustrates patterns within the data and those data distributions. But as mentioned, it doesn't determine cause. It doesn't say that variable X affects variable Y. Now, regression is a type of correlational analysis, but it does look at the predictive power of variables, and it does enable us to predict how one variable does affect another. And we looked at this in the studies that we've examined previously, David Clark's study and the Dutch study looking at patient consultations. So it's a correlational technique, but it does have predictive power and does look at cause and effect. So it's a bit of an anomaly within correlational research. Studies these days don't really normally just do correlational research. It's too simple. They can be done, but it's really doesn't explain a huge amount. But regression analysis is a very popular and very common technique within research studies. This is an interesting correlational study from a German group, and it looks to identify the relationship between quality of life and the burden on family caregivers. Again, it uses the cohort design and uses correlation and regression. And the methods, they recruited 100 patients and caregivers, and they looked at the burden through questionnaire application for caregivers. And the results they found in this study that the patients had low quality of life, but actually that quality of life increased towards death. But caregiver burden did not deteriorate over time. However, if the patient had mood problems, depression, anxiety, or if they had dyspnea, that did have an impact on the caregiver burden. And this is where the regression analysis comes in and is important. So we can see from the graph here that on the y-axis, there's the patient's dyspnea, and on the x-axis, there's the caregiver burden. And the regression line here shows that as the patient's dyspnea increases, so does caregiver burden. And again, if we look at another graph within this study, again on the y-axis here, we can see mood, and on the x-axis, caregiver burden. And again, here, lower scores in mood identify as a poorer mood. So again, we can see that as the mood deteriorates, caregiver burden increases. Now, correlational designs are quite popular. Simple correlational designs you don't often see in research studies, but regression techniques are frequently used in different types of research papers. Okay, the third thing we want to kind of look at is quasi-experimental or causal comparative research. Now again, this does look at causality between different types of variables and tries to mimic closely the natural or scientific method, but there are some limits within quasi-experimental studies. So quasi-experimental studies often happen in what's called real-world settings or real-world situations, and they're useful when there may be limitations to what you can do with your study. So for example, you may not be able to have a true control group, or it may not be practical to randomize your sample. So that's one of the things that quasi-experimental studies have, is they don't have a true control group, and there is less manipulation of the variables within quasi-experimental studies. However, because they often take place in natural settings, they have good internal and external validity. So the internal validity is that actually we can attribute the cause and effect to the variables that we're examining, and the external validity, or which is sometimes called ecological validity, is that we're likely to see these results elsewhere, or the results are generalizable. So, an interesting quasi-experimental study is this study done in the south of England here, which looks at the impact of a rapid response hospice at home team on the ability for patients to die in their preferred place of care. So, quasi-experimental study, multi-centred, so conducted over a number of sites. So they looked at community services within hospices and had over 900 patients and 64 carers. Now, interestingly in this study, there was no significant difference between the control group and the experimental group or the intervention group in the number of people or patients being able to have their preferred place of care in terms of where they died. And it's interesting and it's really valuable. Often what are sometimes called negative studies, such as this, that don't actually show any effect, aren't published. But it's really great that the authors of this study actually managed to publish this, because it helps us make sense of the effects of things like rapid response teams, and it adds to the evidence base. Now again, within this study, it's quasi-experimental because they didn't want to have a true control group. So within the hospice setting, what they didn't want to do is to give some of the patients, allocate them to a group where they may have hospice at home, and the other group where that wouldn't be possible. And again, quasi-experimental studies are useful when there's that kind of ethical conflict. But one of the things that they did within this study was they used what's called a step wedge design. Now, this is a way to establish control groups without compromising patients' care, really. So, and again, what we can do within this step wedge design is that you can look between different groups. So, and you, in this situation, you can control the Canterbury group against the Thanet group and the Ashford group, but also you can look within groups as well. So at the Ashford group, you can use their control data and then actually look later at the intervention group as well. So this is a really useful way of establishing control groups in quasi-experimental studies. And lastly, we look at experimental research. So again, this is used to examine causal relationships and very much tries to follow that traditional scientific method. There's the manipulation of at least one independent variable, and through the use of control groups, all the other confounding variables are controlled for. So again, we can really have great confidence that the effect of manipulating the independent variable on the dependent variable is the causal relationship that we're examining. There's a random assignment within this, and again, it's a highly controlled, objective and systematic approach to collecting data and trying to make sense of the different relationships within the clinical setting. So again, this is a very famous, probably the most famous research study done in the last years within palliative care. This is the TEMO study looking at early palliative care for patients with non-small cell lung cancer. So within this study, they were interested in introducing palliative care very early to lung cancer patients post-diagnosis and looking at the effect of that. And the design for the study is a randomized controlled trial, which is the strongest research design that you can use. So the methods within the study, in terms of the questionnaire, they used a functional assessment of cancer therapy scale and the HADS, which is an anxiety and depression scale, and date of death. Now, in the results, it's really interesting that they found that in the experimental group, patients had much better quality of life. And again, you might expect that because of the way palliative care works and what we expect palliative care can do. But the really interesting finding from the TEMO study was also that survival was longer in the experimental group. So that's the group that actually had early palliative care. So on average, 11.6 months in the experimental group and 8.9 months in the normal care group. And again, this is a really interesting study because it really advocates for the early integration of palliative care. So again, we can see here in the data that's presented, you can see the mean change between the standard care group and the early palliative care group. And again, the Kaplan-Meier graph here shows that patients who had early palliative care lived on longer. And again, really interesting here to look at about 20 months, you can see the difference in the number of patients surviving. Up to 20 months is quite stark between the two groups. So the advantages of quantitative research and quantitative research design is it really helps us to test theory and test hypotheses robustly and look at the relationships between the variables and look at causality. There's an objectivity to this type of approach and the ability to control extraneous variables or potentially confounding variables. And again, the results we get from these types of study can seem to be have limited bias, and bias is something that we'll look at when we look at different statistical techniques, and because it can be a bit of a challenge. And again, what quantitative research gives us is specific answers to particular problems, and again, that can be really helpful in advancing practice. Disadvantages to these types of research, and particularly the experimental research, is something like a randomized controlled trial is very difficult to set up, very expensive. It can take a lot of time to set up, and the challenges within the palliative care population mean it can be quite difficult to collect sufficient data. It really requires careful planning. We need to make sure that the randomization is done accurately, that our control groups are actual control groups, that we try to minimize bias, but it's not always possible to do that through techniques such as blinding. So blinding the researchers to actually whether a patient is in a control group or an experimental group. And sometimes we can do what's called double blind, where patients don't know which group they're in as well. But again, that's very difficult with something like an intervention such as within a TEMO study, having access to early palliative care. Quantitative data can also be seen as shallow. It can be very broad. We collect a lot of data, but there are arguments actually about when we think about the scales that we use, how accurate those scales are in actually defining and describing particular concepts. And a key thing with quantitative studies as well is that it often requires specialized statistical analysis. Statistical techniques these days are much more complicated and much more, there are many more elements to the different types of analysis that can be done, and it's a specialist skill in and of itself, so it often requires statisticians to be involved in those types of studies to make sense of the data and to help us understand what the data is actually telling us. So we've covered quite a bit there again, and again, hopefully you maybe read some of those studies and actually think about the design and actually the strengths and weaknesses of the different designs within those studies and other studies that you may be interested in. So we've talked about descriptive studies and descriptive design, which tends to be illustrative. It doesn't formally test hypothesis, but it can identify trends within the data and give us a picture of what's going on with a particular group or a particular subgroup of patients. We looked at correlational research as well, and it tells us the relationship between variables. It doesn't imply causation, but we can use regression analysis to look at the effect of one variable upon another and its predictive power. We finally then looked at quasi-experimental studies and experimental studies, and again, these are much stronger in looking at the relationship and looking at causality, but again, experimental studies, because they have that true control, are often much stronger and much more robust in identifying that link between one variable and its impact on another. So thanks for bearing with me with that session. Again, what we will do if you are in the group, within the teaching group, we'll be looking at some research questions and trying to think about what design may fit the different types of research question. Okay, thank you.